It's my pleasure now to introduce Dr. Warren Selman, our first speaker, Chairman of Neurologic Surgery at University Hospitals in Cleveland.
Thank you, Nick and Peter. Thank you, ladies and gentlemen. So I'd like to start by showing you the case of a 47-year-old man who presented to our hospital with subarachnoid hemorrhage from a pericallosal artery aneurysm. But before I do that, I want to really set the stage for you and show you how really, as Nick talked about, this immersive technology helped change the way we cared for this gentleman. So you're going to see on the screen behind me the standard views that we use when looking at anatomy from the patient's images on a CT angiogram. But I want to first start out by remind you what Michael Jordan said, talking about improvement. He said, no matter how good you are, always keep working to improve your game. And I think that's really what we're going to talk about today. How can we improve our game? So I am from Cleveland, obviously, proud of the Cavaliers, and if we stick with the basketball theme, Coach Bobby Knight said, the key to success or winning is not so much in the desire to win, because everyone has that, but it's the desire and the will to prepare to win, to prepare for success. And how do we get that preparation for success? Well, nothing is more important, actually, than visualizing that success. So really keeping that in your mind. So if we think about elite athletes, everyone knows that they really visualize what they're going to do to succeed. But if you're tired and had enough of all the sports analogies, remember that over 100 years ago, Henry David Thoreau said, the key to achievement is to keep a picture of success in your mind. And I'm going to show today how that virtual reality will allow each of you to get that picture of success. So again, I'm going to start by presenting the case of this gentleman and show you here is the anatomy that we had with the CT angiogram. It's what we're all used to looking at. It's the three plane views that we see, and it's very helpful for getting an idea of where the aneurysm is. But if you give me a second, I'll put on the goggles and show you what that image can be transformed into. So this is taking that patient's same anatomy that you got from the DICOM images, and now what we're doing is actually looking at a view of the patient's skull, and you can see the aneurysm before me. And what I'm going to do is take you through the surgical corridor. I'm going to fly in along the surgical corridor, which is the purple lines that you see, and bring you closer to the aneurysm. Now this is the surgeon's eye view, and it's very helpful for getting an idea of what you're going to see through the microscope. But what I want to show is different about what we can do with surgical theaters. Not only can you see the anatomy in front of you, but you can see what is behind you. And that simply isn't possible in any other way. So I'm going to look around, and now you'll see that I'm looking at the back side of the aneurysm. I can get a view and know that not only will we have to deal with what we can see, but we'll have to deal with what we can't see. And this allowed us to plan for our surgical approach in a way that wasn't possible before. So looking at that, we figured we would start with the right angle clip that would allow us to secure the top of the aneurysm. And as you can see, this is helpful for getting that portion, but we knew we'd have to do something to deal with the backside of the aneurysm. So surgical theater allowed us to plan for the approach by using fenestrated clips and then successfully execute that plan that you'll see here. So now the clips are in place, and what I want to do is show you again what that looks like now from the back side. And you can see we're able to secure both sides of the aneurysm. So is this just a video game, as Nick pointed out? Not really. This is actually how reality looks. So I'm going to show you what this turned out to look like at the time of surgery by using what you actually see at the time of clipping. So the surgeon not only rehearsed what he was going to do, but was able to actually execute on that. And this again shows the clips going in place just as we rehearsed. And now you can see the final clipping. The aneurysm is secured and all the vessels are intact. So again, we were able to plan and then execute on the basis of this. So I think you can see I'm going to take the goggles off now, but I think this allows us to do exactly what Michael Jordan said, and that is to always keep working on our game.
Warren, have you found that this technology can be used for preparation of surgery for any other ways?
Well, in fact, it can, Nick. What we've found is very exciting is that if you think that it's important for us to be able to see that, it's actually more important for the patients to be able to see that. This is where technology is not driving a wedge between physician and patient. It's actually bringing us closer to the bedside. Because when the patient puts on those goggles, the old statement is really true. A picture is worth 1,000 words. It just doesn't do justice to how engaged the patients are. And in fact, we've received funding to look at this in a larger group of patients to see how well we can interact and improve actually patient engagement with the use of this technology.
Thank you, Dr. Selman.
Thank you all for your attention.